Good day, Woodstock. Today is Monday, April 6th, 2020, and we're doing another video for the pandemic to give you some information and update. And I'm really pleased today to have actually my former boss from Northside Hospital, Cherokee, Katie Pearson. She's the Chief Operating Officer. Hello, Katie. Good to see you.
Hey, Donnie.
Got some questions for you. Feel free to expound as much as you want on them and have fun with it.
Sounds great.
How has the hospital operations been altered to respond to the pandemic?
We have clinical and administrative staff who on a daily basis assess our bed capacity, staffing, surge plans, personal protective equipment supplies, ventilator capacity, and other needs. We have identified areas of the hospital that can be converted to additional isolation rooms as needed. We have staff redeployment process that enables us to assign people to the most needed areas. Northside surgeons, following current guidelines from the American College of Surgeons, are carefully reviewing all elective procedures and postponing those that can be safely delayed. We are screening essential staff and vendors prior to entering the hospital 7 days a week, 24 hours a day.
Great. And how has the hospital put any restrictions on visitors, and what are those restrictions that are in place?
So to prevent the spread of COVID, Northside visitation has been tightly restricted at all of our campuses. This was not an easy decision to make, but it was absolutely necessary to protect our patients and our staff. We will continue to reevaluate our visitation policy, and you can find the current details at www.northside.com/COVID-19. I would ask that you go there and look because it can change as we go along.
Okay, great. We hear a lot nationwide about ventilators. What's Northside doing about that? Is there any shortage?
Supporting and protecting our patients and staff is our top priority. What they're doing is unprecedented. As mentioned before, we are monitoring our equipment on a daily basis. At this time, we do not have any issues providing ventilators to patients if needed.
How about PPE? We hear a lot about shortages around the country. Is Northside experiencing anything? And if so, what are y'all doing?
We are monitoring, as I mentioned earlier, on a daily basis for PPE, which is personal protective equipment. And at this time, we do not have any issues providing PPE to the patients or staff as needed.
Great, good to hear. We've heard that many Northside physicians and practices are offering virtual visits now. If someone has never used telemedicine, how does that work?
So most of our Northside network providers are offering telehealth. It allows patients to connect with their personal physician from the privacy and safety of their office or their home. What will happen is when patients call their doctor to schedule an appointment, they will be given the option of an in-person or a virtual visit. If they opt for a virtual visit, the physician's office will email instructions on how to connect online, and they will use their computer or iPad or even their phone.
Great. And what about the testing that y'all are doing for COVID-19 at the hospital? How's it work, and what are the criteria, I guess I'm meaning to say?
So let me start by talking about what we're doing on outside of the hospital. Northside has installed fully equipped tents at our emergency departments to support triage should the patient volumes increase. If patients exhibit minor symptoms of COVID, they do not require testing. They will be evaluated in the tents. Patients with more severe symptoms will be evaluated and receive possible testing in the emergency department and prepared for appropriate treatment. So it really is a patient-by-patient decision.
Okay, what message would you like to share with the public you serve?
We are so grateful and appreciative for the support we are receiving from the community. One of the most important things the community can do is stay home and wash your hands regularly and thoroughly. Keeping yourself and your family healthy helps ensure less people become infected and admitted to our emergency department, which allows us to focus on patients currently under our care.
And for members of the public that want to, what can they do to help right now, if
Well,
anything?
if anything, we would like to say thank you to the many groups and individuals who have sent meals to the hospital for the staff. We're not asking you all to do this, but wanted to thank you for the generosity and support you've provided. What we do want to ask is what I mentioned a few minutes ago: washing your hands regularly and thoroughly, respecting and following the shelter-in-place order to keep you and your family safe and healthy, which will allow us to get past this event much faster.
Great. Is there any final message you want to share?
I just think if everyone does their part in this process of, staying at home and avoiding going out whenever possible, it'll be the best thing we can do to continue to move past this and get to a better place.
Well, Woodstock and Cherokee County, you can see Katie has the type of job that is impossible to stay home. She has to be at the hospital. But here I am at home, sheltering in place as much as possible. And I certainly recommend, as Katie does, to stay home, please, so you don't infect others, even if you're not symptomatic. Thank you, Katie, and it's good to see you again. Talk to you later. Woodstock, stay safe.